So hello everybody and welcome to today's webinar where we're hopefully going to give you some tips and tricks for troubleshooting living with your laryngectomy. Next slide please. So first of all, as always, I must advise you that this is a corporate presentation from Atos Medical Group. Nothing in this presentation provides any diagnosis, clinical advice, indication, guide, warranty or guarantee. Nothing in this presentation can substitute individual advice or guidance from a qualified healthcare professional. All testimonials relate to how one individual has experienced the Provox Life products, and not every person will get the same results. This event is being recorded, so that's why Faye's just hit the big red button, and by joining this webinar, you're consenting to being recorded during this event. So at the end, as Hannah's just mentioned, there's going to be a question and answer session. So please feel free to type any questions or comments that you might have in the chat box, and myself and Faye will try to answer as many as possible at the end. Okay, so can we go back a slide? There we go. So let me introduce you to the presenters today then. So Faye is a clinical educator with Atos Medical, and she's a speech and language therapist by background. And I'm Catherine, I'm a head and neck nurse with Atos Care. Ashley's also a head and neck nurse with Atos Care and was going to join us today, but unfortunately she's not well. So I think she's sitting in the audience watching. So hope you're feeling better soon, Ashley. Next slide, please. Over to Faye to kick off the presentation then.
Okay, so today we're going to cover a few different topics throughout the presentation, and the first part of this webinar is around how to manage your mucus. So we're going to have a little bit of a deep dive into how it's produced and what we can do to help manage that. So next slide, please. So I think it's really important to notice that actually it's normal for us to produce mucus. Everybody's lungs produces mucus, even for people who haven't had a laryngectomy. It's one of the ways that the lungs tries to actually clean themselves. So what the mucus is there for is it traps that dust, the dirt and other particles, and how we move those out of our body to keep us safe is by the mucus. So we would cough, we would sneeze, and gradually these particles would be expelled out of our bodies through those mucus. We actually produce about 2 litres of mucus per day, and that's normal for us. But we do actually manage it a little bit differently. So before a laryngectomy, mucus is brought into the back of the mouth and swallowed, and we often don't even notice it. So we can get rid of a lot of that mucus by swallowing it down, or we may expel it via coughing and sneezing. However, after a total laryngectomy, of course, the lungs are no longer connected to the mouth. So all of that mucus that needs to be expelled is now brought out of your stoma. So if we can have the next slide, please. It's really important to understand what is normal. And obviously, as we mentioned, we can produce about 2 litres of mucus a day. We have to get rid of some of that. A lot of it is done without us realising. But our mucus can tell us quite a lot about our health. So it's important to recognise that if you're an ex-smoker or if you have a pre-existing lung condition like COPD, your normal mucus might be a little bit different to what we would expect. You can see here on this chart that we have a different range of colours of mucus. So if your mucus is very clear and it's thin, then that would indicate it's a normal and healthy mucus that we're producing. And this is what we would expect if we were coughing or sneezing and we didn't have any underlying health problems. Sometimes it can also be normal for some people, particularly if they have a pre-existing lung condition or if they're an ex-smoker, that their mucus is white, so a little bit more than being clear, and it can be quite thick and a little bit stickier. It can also come along with a feeling of being a little bit congested or dehydrated. So again, for patients who potentially have COPD, then this may be your normal level of mucus. If the colour of your mucus then becomes a little bit light yellow or a little bit green, then this can indicate that your body is actually fighting off an infection. Often these infections we can fight on our own, and we don't need to potentially have any intervention from a doctor. But it's good to notice what colour phlegm you're actually producing. If it's that darker yellow or green, then obviously that would indicate a more severe infection. And especially if it's accompanied by fever, or if you're coughing, sneezing, or feeling generally under the weather, then this is where you would definitely want to be looking to get an appointment with a doctor just to check out what's going on. Obviously, if your mucus that you're producing is tinged with, if it's pink or red, so it may be tinged with blood, then we would absolutely advise that you speak to your doctor or your clinician as soon as possible to identify what's going on. So it's really important to understand that obviously our mucus can be very different based on our individual health, our pre-existing conditions that we have, and our lifestyle choices. But it's always good to have that indication of when you should be seeking medical advice. Next slide, please. So a lot of you will be using HMEs, and what a HME is it's a heat and moisture exchanger. And in essence, it's, in a simple way, it replaces the function of your nose. So after a total laryngectomy, as you are breathing now through the stoma in your neck, you're no longer taking in air through your nose and mouth, where it will be filtered from small dust particles, and the air will be warmed and restore some moisture to that air before it gets to the lungs. So if you don't have anything over your stoma, then obviously all of that cold, dry air is going directly into the lungs, and that can make you produce a lot more mucus. How we prevent that from happening is by using the heat and moisture exchanger. A lot of people might call them filters or cassettes that go onto either a base plate or into a Larry tube or Larry button. What that heat and moisture exchanger does is that it actually helps to reduce that mucus buildup. It reduces the coughing, and it also keeps your stoma a lot cleaner, so you don't get any crusting from any mucus that goes through. The knock-on effect of that can be that it can improve your sleep, energy, and quality of life. Now, how the HME works is that within that cassette, they actually have a foam, and you'll be able to see that if you turn your HME upside down, you'll be able to see the foam within the cassette. Now, that foam is actually coated with calcium chloride. It's coated with a salt, and it's deliberately coated with the salt so that as you breathe that nice warm and moist air out through your stoma, it gets trapped in the foam. So when you then breathe in all of that dry and cold air, as it passes through the foam, it gives it moisture and heat before it goes back into the lungs. And what that does is it helps you to have normal amounts of mucus that you're producing that aren't too sticky or too difficult to clear. So hopefully that gives a little bit of an idea of what the HME is for. So almost to replace your nose, and how it works in terms of trapping that nice warm heat and moisture from your lungs, so that when you're breathing in that dry and cold air, that it gets heated and warmed before it goes into the lungs. Next slide, please. Thank you. So a lot of you will already be aware that the Provox Life range of HMEs that we have here at ATOS, there are actually 6 of them. So what's the difference between the HMEs, and why do you need to change to a nighttime HME? So we know that there isn't one HME that will suit everybody all day. It's almost impossible to get a HME that acts like a nose. When we have more effort that we put in, so if we're walking up and down the stairs, then we might need to breathe through our nose and our mouth before a total laryngectomy, but obviously post laryngectomy you're not able to do that. So what we did with Provox Life is design specific HMEs that would suit the activity that you're doing. What we know from the clinical research, which is really important, is that if you wear your HME for 24 hours a day, it has a very good positive impact on your lung health and quality of life. What people find is if they're not using a HME for 24 hours a day, they often have increased coughing, they'd have difficulty sleeping at night because the coughing will wake them, and it's more difficult to manage the mucus. Now, by wearing a HME or a heat and moisture exchanger, it will definitely reduce the amount of mucus that you're producing because it normalizes the lungs. And that can also then have that knock-on effect of improving your quality of life. And that makes it a little bit easier because you're not having to think about coughing and the amount of mucus that you're producing. So how do you get the best out of your HMEs? If you use a HME during the day and during the night, and you use it for 24 hours in the day, then that is where you're going to get the maximum benefit for your lung function. You can replace your HME regularly. So obviously we would advise every day that you would replace perhaps a home or a go or a night or an energy or whichever one that you're using. And sometimes if we're not able to tolerate HMEs, it can take a little while to sort of build up your tolerance to that little bit of resistance. So again, it's about seeking support from your clinicians, from your ATOS care nurses, to help support you having the best possible quality of life. Next slide, please. Okay, so as we mentioned, using your HME 24/7, you do have a better outcome, a better quality of life. You'll have a better day and a more restful night through that reduction in the coughing and mucus. Sleep, I don't know about any of you, but if I don't sleep, I am not a pleasant person. So it is definitely a vital part of my lifestyle and keeping a healthy lifestyle. What using a HME can do for you if you're using it 24/7 is it can actually improve your memory, lower your stress levels, keep your heart healthy, because if you're not coughing and waking yourself up during the night, you do a lot of healing. Your body heals and rests overnight. We actually, as part of the Provox Life range, have a nighttime HME, which can sit within any of your daytime base plates or tubes or Larry buttons. So it actually helps to, it's got the highest level of humidification. So it really helps to restore that lung function from any changes throughout the day. And it can help reduce coughing for those restful nights. That's really important. So obviously it does have that higher humidification compared to other HMEs during the range, because at night we have much more restful breathing. We're not needing as much air to go into the lungs. We need more heat and moisture to keep the lung function stabilized. The nighttime HME obviously is really comfortable for breathability as well. And it's nice and soft. So when you're moving in bed at night, it doesn't tend to pop out, and it can be really comfortable. What we did find from some studies is after 12 weeks of using the Provox Life for 24/7, users reported that they preferred the Provox Life compared to their previous HMEs. So we know that the evidence is supporting this as a range of products to help with your lung function. Next slide, please. Okay, so just a little bit more on the Provox Life Night. A lot of patients that I certainly have worked with will use their daytime HMEs overnight, and that's okay. So long as we're using something 24/7, that's great. But in order to get the best out of your HMEs, and in order to get the most comfort and the most resolve from the coughing, using our nighttime HME is really important. And the reason being that you've got very, very high levels of humidification. So it helps to restore the balance of the lungs whilst you're sleeping. So the Provox Night HME, it actually has now a ribbon across the body of the HME. So it's improved in the way of that we connect it and disconnect it from the secure fit on the base plates, and also on the Larry tubes and the buttons. And again, as part of our corporate values and initiatives to be more environmentally conscious, we have changed the manufacturing process for the Provox Life Night HME to reduce our environmental footprint. So a couple of just quick things that are really important. 80% of patients choose to use the Provox Life Night HME, and that came out of a study that was carried out in 2022 by a hospital in Rome. So you can see the foam and the picture is very, very dense, so it retains a lot of heat and moisture. And if you're changing HMEs throughout the day or having periods where you're not wearing a HME during the day, this will help to restore that balance of the lungs, and it can be really beneficial for helping to reduce the amount of mucus that you have. Okay, next slide, please. I'm going to hand over to Catherine, who's going to take you through skin irritation.
Okay, thanks, Faye. Next slide, please. So after surgery, your skin may feel different. It might be a bit sore and it might get easily irritated. For a short while after the surgery, it's quite normal for there to be some inflammation and redness around the area where the incision has been made. This is the body's natural healing process, and it's nothing to worry about. If it persists for longer, then obviously it's best to get checked out with your clinician. It's important that you keep the area around your stoma and around the suture, the incision, clean, particularly ensuring that there's no mucus left on the skin. There are enzymes in mucus, and if the mucus is left on the skin, these enzymes can cause irritation and soreness. For those of you who wear base plates, ensure you remove all remnants of the adhesive and also the adhesive remover off your skin, as leaving this on the skin can also cause irritation as well. There are products which are more suited to sensitive skin or for people who are having issues with other particular products, and they can be used when skin irritation is present. Next slide, please. Okay, there are several factors which can cause skin irritation. These are the three main ones. So mechanical skin stripping. If you don't use an adhesive remover to remove your base plate and just pull it off, this can actually pull off the top layer of your skin, leaving it red, very sore, just like in the pictures here. Correct base plate removal only takes 2 or 3 minutes, and it minimises the injury to your skin and helps to reduce any irritation. I will talk a little bit more shortly about how to remove base plates. Maceration is the next common cause. It's when the skin becomes excessively wet. Perhaps mucus has been left on the skin, or the skin hasn't been dried fully following cleaning. In this situation, this can actually delay wound healing. So ensuring the skin is cleaned and dried fully can help to minimise this. And contact dermatitis is an immune response or a reaction to skin irritants. Looks a little bit like eczema. Skin becomes red, itchy, blistered, dry and cracked. And if you experience a reaction like this, please contact either your speech therapist or your head and neck nurse, or even GP. And on some occasions, some people are referred to a dermatologist for further assessment and treatment if it persists. Next slide, please. So skin irritation it might sound a little bit strange, but it can actually also result in poor lung health. When the skin's irritated and sore, some people take a break from wearing their base plates to allow their skin to heal. However, it also means that they often take a break from wearing a HME. And as Faye's just mentioned, wearing a HME 24/7 is recommended for good lung health. Taking breaks from wearing them can lead to an increase in coughing, increased mucus levels and thickness of mucus, and also disturbed sleep. And as Faye just mentioned, some of us aren't great with a lack of sleep, me being one of them. Next slide, please. So I'm sure that by now, a lot of you who have attended these webinars before will know that there are different shapes and sizes of base plates, as well as base plates that are made of different materials, specifically for sensitive and non-sensitive skin. And choosing the right adhesive for your skin and stoma type can help to reduce the chance of skin irritation and provide you with a good seal throughout the day to help with your lung health. So if you are going to try a new base plate for the first time, we recommend doing a patch test to find out whether you're going to react to the material or not. To do a patch test, just cut off a small piece of the base plate, stick it to your forearm and leave it there for about 24 hours. When you remove the patch 24 hours later, if there's no reaction, chances are you'll be fine to wear the base plate. If there is a reaction, you can consider contacting your clinician at the hospital to find out about an alternative base plate, or whether a Larry tube or Larry button might be appropriate for you. instead. Next slide, please. So a couple of slides ago, I mentioned about removing your base plate correctly and how this can help to minimise skin irritation. Well, correct application of a base plate can help as well. So we're just going to go through this slide here. Removing your base plates, always use an adhesive remover wipe. If you're wearing a base plate such as Provox Life Standard, rub the adhesive remover wipe over the top of the base plate and then allow the adhesive remover to penetrate the base plate just for a few seconds to help break down the adhesive. Then, by taking hold of the tab on the base plate, start to gently peel, and as you're peeling the base plate away from the skin, at the same time, use the adhesive remover wipe to rub where the skin meets the base plate, just to help break down the adhesive even further. By doing this, it's the least traumatic way of removing your base plate, and it really does reduce the risk of skin irritation. Once the base plate has been removed, make sure you clean your skin. Don't leave any remnants of the adhesive remover on your skin either, because this can also cause irritation. If you think about it, the adhesive remover is a chemical. If you leave the chemical sitting on your skin, it will cause a reaction. So make sure you do clean it off properly. And once the skin has been cleaned, allow it to dry thoroughly and then apply a barrier wipe. So the barrier wipe will leave a thin film over the skin to protect it, but it also does help the base plate to stick as well, because it becomes a little bit tacky and helps with the adhesion of the base plate. Whilst you're waiting for your skin to dry and the barrier film to dry a little, warm the base plate in your hands or in your pocket. Some people put it under their armpits whilst they're doing all their cleaning. This actually, by warming it, it actually helps to activate the adhesive. When you've warmed it, peel off the protective backing and apply the ring in the centre over your stoma, and ensure that that ring is as flush to the skin as possible, so there's no gaps underneath it and no air can leak underneath it. Once the ring is secure, then massage the rest of the adhesive onto your skin, making sure that there's no creases in it. If anyone wants a copy of this slide, we're more than happy to email that out to you. Hannah can arrange that for you. Next slide, please. So showering then. For the first time after surgery, the thought of going in the shower with a stoma can be quite daunting, but it is also a sign of progress in your recovery as well. Your open stoma serves as a direct pipeline or a direct route into your lungs, and it is important that you protect it from water getting into it. So when you're showering, there's the shower aid that you can see on the picture here, which is a special cover that's designed to keep water away from the stoma. It can fit into the base plate, the lary tube or lary button. And for a belts and braces approach, you can also wear a cascade shower protector as well, which is like a plastic bib. So wear the shower aid and then the bib over the top, as I say, for a belts and braces approach. Next slide, please. And now I'm going to hand you back to Faye.
Okay, so learning about your taste and smell, and often this isn't always something that is perhaps discussed before you will have your total laryngectomy, and depending on the clinicians that you might meet, they'll depend on whether they will give you any sort of strategies of how to manage this. But obviously after a total laryngectomy, there can be an impact on your taste and smell. Next slide, please. Okay, so again, as we mentioned, after a laryngectomy, your taste and smell will change, leaving most individuals with either limited or requiring a lot of spice or strong smells to be able to have any sort of taste or smell. So that it's definitely impaired after a total laryngectomy. Fortunately, there is an exercise called the polite yawn that can help. And I know that we're planning on doing a specific webinar later in the year, specifically around taste and smell and how to get the most out of that following a total laryngectomy. So definitely watch this space for details about that one. But as a brief summary, what tends to happen after surgery is normally the smell is carried by particles in the air. Before your laryngectomy, obviously, you breathe through your nose. So the air is pulled into that space behind the nose and passes directly over those receptors. So your smell receptors are there, and what they do is they send messages to your brain about that smell. That's how we know when something smells good and when something doesn't. So not being able to smell food when it's being prepared and eaten definitely has an impact on the appetite, particularly for some people more than others. If you think about sort of pre-laryngectomy, for those who haven't had a laryngectomy, it might be things as simple as having a cold where you can't smell your food and your appetite is decreased. But obviously following a total laryngectomy, that's going to have a bigger impact. So much of what we taste does have to do with what we can smell. So that loss of smell can also have a knock-on effect on the taste sensation. And furthermore, if you have had radiotherapy, it can have affected the production of saliva and how different tastes are perceived. Now, we do require saliva to be able to taste food. So in order for us to have that taste, the chemicals from the food must be dissolved in saliva. Once dissolved, then those chemicals can be detected by those taste buds. And that's how we are able to taste. So it's really important that we recognise for those people with very dry mouths following radiotherapy or surgical intervention that actually that's another reason why the taste isn't as good. So the other reason that you may have difficulty with this area is obviously challenges with swallowing. Some of you will be having a normal diet and normal fluids, and that's okay. And others may be on an altered diet. So maybe softer foods, having to have things with extra moisture. Chewing is a really important function because it does allow the food that you're eating to touch all of those different taste centers within the mouth. So the smell of the food that's in your mouth reaches the smell receptors via the back of your throat, and that combined with the chewing gives you the ability to taste, and it also gives the smell for the food. It gives you the flavors and the smells. So without getting the taste sensations, eating can be very, very bland and people can lose their appetite quite a lot. And what we do know is that we do require a really good level of nutrition and hydration to keep ourselves well and to also help with that healing process post-surgery. Next slide, please. So how do we teach or have a technique that can help us with our taste and smell? So we will go into this in a lot more detail on a future webinar, but basically the polite yawn is a really, really helpful way of increasing some pressure, which also then stimulates those taste buds and smell senses. So what you need to do is try and make an extended yawning movement whilst keeping your lips closed. And simultaneously, you're lowering that jaw, the floor of the mouth, the tongue, the back of the tongue and the soft palate. So it is literally like trying to yawn, but with your mouth closed. What that does is it creates this under pressure in the oral cavity, and that increases the amount of air that flows through your nose. So even following a total laryngectomy where you have no connection between your lungs and the upper respiratory tract, by doing this exercise, you are able to suck some air within that tract to stimulate those senses. So this might be something that can be really helpful for rehabbing and getting you back some level of taste and smell by stimulating the receptors. A couple of other methods that are out there, things like tongue pumping. So this is sort of a bit like a sucking motion. And again, if you do that over and over again, that can have a positive impact on those taste receptors and the smell receptors. And also some people find that sniffing and swallowing at the same time has a similar effect. But again, like we said, it is one of those issues that some of you will have had some rehabilitation for and others may not have, but we're planning on covering this in a future webinar. Next slide, please. So Catherine's going to talk about taste.
Thanks, Faye. I was just sitting here wondering how many people in the audience have actually just tried doing that polite yawn while you were speaking through it. So Faye's just spoken to you about the polite yawn, how it can improve your smell and taste. But how else can we look at improving our taste? So food, as Faye mentioned, it's one of the most basic needs that we all have. And enjoying the taste and the smell of food is, most people think that equals a good life. I know I certainly enjoy the taste and smell of good food. So one way of adding extra taste or extra flavour is by adding spices and seasoning to the food. Spices don't just have to make food hot. There are many spices that flavour the food as well. There are also essence drops as well that you can purchase to enhance the flavours. I don't know if any of you were on one of our, we did a cooking webinar. I think it was about 2 years or coming up to 2 years ago now. And the lady that presented, she was talking about these essence drops and how they're great at actually enhancing the flavour of the food, whilst not. So, for example, for something that's particularly spicy, it enhances that flavour, not the actual heat. So you might want to look into that, search online, search the supermarkets for these drops. You can also get creative with how you can substitute things in recipes. So, for example, if you don't like tomato-based foods, or you can't, tomato is something that you can't taste particularly well, you could try mixing it up a bit and swapping it for roasted peppers, aubergines, courgettes, squash, for example, and see if that tastes any better. It really is a case of playing around with food and finding the flavours that you like and that you can taste. Going back to the spices, if there's anything that's particularly a little too spicy for you, you can try adding dairy products to things, to foods, to make it milder. So, for example, like yogurt, that helps to cool the heat down in particularly spicy foods. Try new flavour combinations as well. So pairing sweet and savoury things together, or something bland with something that's quite sharp. I don't know, you tell us, what do you do to make your food tasty? Who out there has managed to come up with something to enhance the flavour of their food? Next slide, please. And let's face it, there are lots of different cuisines that we can tap into, that we can try. So if you particularly an adventurous eater, take the opportunity to rediscover these new foods and tantalise your taste buds. Have fun with experimenting with foods, whether you're baking a cake and trying different ingredients, or whether you're cooking, for a partner, a loved one. Try something new. It's a great chance to experiment and find out what you do and you don't like, and keeps, as I say, stimulating that taste with various flavours and flavour combinations. Maybe even challenge yourself to try something new each week. Next slide, please. So I look forward to hearing all these suggestions in the chat box when we start the Q&A session in a couple of minutes. So as always, from our customer care team and specialist nursing team to these online events, here at ATOS Care, there's always somebody here who's happy to support you and answer any of your questions. You can also join our online community on Facebook, Twitter and YouTube. And don't forget your SLT or your head and neck nurse at the hospital that are also there for help and support as well. Next slide, please. Okay, so now it's time for you to ask myself and Faye anything. So please type your questions into the chat box and we'll do our best to answer as many as possible. So if we had anything come through.
Just a couple. I think Noel was just asking about how long you would do the polite yawn and like how often during a day.
So really, the polite yawn is one of those techniques that you can do as many times during the day as is comfortable for you. Really, what you're not doing is changing any of the anatomy. You're just creating a level of pressure, which will then suck in some air, which will stimulate those receptors. Often, I would particularly do it when you have something that you're either going to taste or smell, and do it a couple of times before you have something to eat or want to smell something, so that you can see if there's an impact, but also definitely a couple of times before you're going to eat or drink. That's a good time to do it. But realistically, it's something very, very simple that you can do, and the more that you do it and the more often that you do it, the better the impact that you'll have and the longer lasting. But in terms of how you would do that as a starting point, I would definitely say before you're going to eat and drink, maybe do it a couple of times just in the lead up. You don't need to hold it for very long, but like I say, we will do a full webinar on this and some other techniques for increasing that taste and smell. So hopefully that gives you a bit of an idea to start off with. It was really nice to see how many people were actually trying it. How easy did you find it? Did you find it difficult? Any feedback will be lovely.
Fab. We've had another question from Brian regarding the cleaning of the stoma, and he's asked, what do you recommend to use when mucus is stuck to the inner skin and the voice prosthesis?
So around the skin and just on the edge of the stoma, you can use either water and a clean flannel, or some gauze, or you can use saline and gauze, or you could use one of the Provox cleaning towels. So any of those products you can actually use to clean the skin and around the edge of the stoma. For the voice prosthesis, you should have a cleaning brush for the voice prosthesis, obviously so that you can clean that out. And if there's a little bit of mucus stuck on the outside, sometimes that comes away when you actually remove the brush as well. Hopefully that's answered that. Have you got anything else, any other tip? I know some people get tweezers and all sorts, but we don't really recommend
No,
doing
and
that.
I think certainly from a skin perspective, absolutely all of those suggestions are great, and also that the brush is really important when you're using cleaning the voice prosthesis. Something else that can help to reduce the amount of buildup that you get is the flush. Now, I don't know whether anybody's ever seen this, so it looks a little bit like a sort of wand with a bulb on the end that you can squeeze and it blows air through it. Now, you can get the flush that will actually, once you've finished brushing and loosened the sort of debris within the barrel of the voice prosthesis, you can then pop the flush and it clips into the voice prosthesis, and then you can squeeze air, which will take any residue through that voice prosthesis and down into the esophagus. It's not something as standard that clinicians might give you, but it is something to know about, that if you're having this build up, then it may be that using a flush and then a brush and then a flush just helps you to get rid of that debris that might then crust over the surface. Often what we're suggesting is that at least twice a day you're going to be cleaning your voice prosthesis, and potentially after every sort of bit of food or drink that you have, and that should hopefully help to reduce the amount of secretions that crust either within that barrel or also on the front of the voice prosthesis. So hopefully that helps.
We've also got a question around the night base plate, and what that's for and why not just use one of the ordinary other ones.
So like all the base plates, it's individual choice, and it depends on each individual skin as well as to, you know, what base plate suits your stoma shape, you know, the anatomy of your neck and also your skin type. The nighttime base plate is actually what we call a hydrogel. So it's basically like the stuff that they use for on burns, to dress burns with. It's got a very cooling and soothing feel to it when you put it on skin, and it's particularly good for, you know, if you've had a bit of skin irritation with your daytime base plate. If you pop a nighttime one on, it cools it, soothes it, and quite often skin irritation is greatly reduced or gone by the morning. If we go back to what I was saying about you know, people with skin irritation taking a break from their base plates, and that means that they take a break from their HMEs as well. So that has a huge knock-on effect on good lung health and causes mucus levels to increase, mucus to become a bit thicker and stickier and a little bit more difficult to manage. Also, obviously, causes coughing because of the changes in the mucus, and as we've mentioned, disturbed sleep as well, because while you're lying down, you know, start coughing overnight. So some people find that wearing the nighttime base plate overnight actually helps with their skin irritation, but also still allows them to continue wearing a HME and maintain their good lung health. So, but it's each individual's choice at the end of the day. Hope that helps.
Okay, any other questions? We've got one around they're having difficulty. This was submitted before the webinar. Difficulty with swallowing food caused by constriction of the esophagus. Is there anything you can suggest to help with that?
So when you've got a narrowing or what we'd call a stricture within the esophagus, it can have an impact on how you are managing your food and drink. So obviously, if there's a narrowing, what will tend to happen, because there is a change in how we swallow after a total laryngectomy. Before the total laryngectomy, we would use what we'd call peristalsis. So we would have a squeezing motion within the esophagus that would take all of that food down. Because of the way that we reconstruct this new area so that we can have a section that vibrates, so we can get voicing for those who are using a voice prosthesis, the peristalsis movement, so that squeezing motion, is actually sort of gone. So what tends to happen when we're swallowing is that we swallow and it's gravity that sort of takes it down rather than a sort of coordinated motion. What that means for some people who've got a narrower esophagus is that the food can sort of what we call dump on top of that narrowing. So a lot of patients can feel like their voice becomes very gargly. They might have a little bit of residue that comes through the voice prosthesis if they have one. It can feel a little bit like you're getting a bit bunged up. Some of the techniques that we suggest to patients is having something to eat and a sip of water, something to eat and a sip of water. So you can alternate food and drink. The more moisture that you can put into your food and the sort of thinner consistency that you can get, so fluids might not be so much of a problem, but it will be food, then obviously adding extra sauces and gravies to make your food a little bit thinner can often help with that. But usually in terms of how to manage that stricture, I would be suggesting that you go back to your ENT consultant, because they have lots of other techniques that they use to actually sort of widen that so that those problems might go away. They might go away temporarily. It might need to be a procedure that you have done more regularly, but it might alleviate some of the symptoms. So definitely liaise back with your clinicians and your ENT consultants. But some of the things that you can do are liquids, more liquids, and alternating food and drink. Hopefully that's helped.
Have we lost Hannah? I think she's gone on mute, hasn't she? Let me have a look.
Actually, bless her.
Sorry, I'm back.
We were like, right, okay, what's next?
We were relying on you then, Hannah.
I was just having a read of the chat. There's some good chat going on there. Dean's very lucky. He only has to change his base plate once a week.
Wow.
Yeah, I think that's.
Is there anything particular that you're doing, Dean? You know, could you give us a little bit of insight into your regime and how you apply it, and because that's amazing if you're getting sort of once a week. So please feel free to pop any sort of suggestions or things that you're doing different to the regime that Catherine mentioned earlier in terms of changing and cleaning.
Yeah, I think that would be really helpful.
Yeah.
And David was asking around damaged and sore skin. Any other suggestions for kind of things to help other than Cavalon? And I think there's a few suggestions there around barrier creams. I don't know if you guys have any other suggestions.
I think to be able to answer that properly, you'd have to be able to see the skin, to see, you know, redness, if it's any broken areas, for example. So it might be an idea for you to get in touch with your speech therapist or your head and neck nurse at the hospital, if you see them on a regular basis, so they can have a look. It may be that rather than, I'm guessing you probably wear a base plate. So it may be that rather than wearing a base plate, there might be something like a Larry tube or a Larry button that you might be able to wear instead, so that you can still wear a HME and maintain your good lung health, but also allow the skin to rest around that. But yeah, there are lots of different barrier creams. Somebody else has asked about what Cavalon is. It's just a kind of barrier cream. There's wipes, there's creams, there's lollipop sticks that leave a film on the skin as well. Somebody else has mentioned chloramphenicol ointment. Obviously, different hospitals in different areas have different regimes and ways of working, and some hospitals will actually prescribe chloramphenicol eye ointment to put on the skin, whereas others won't. So again, it's a case of going back to the clinician at the hospital and finding out what their protocol is around soreness, but also to get it assessed properly. And if it's something that's persisting for a particularly long time, as I mentioned in the presentation, it may be worth a referral to dermatology to get an assessment. I've known a couple of people get referred and they've been given various ointments, and it seems to have done the trick, but obviously everybody's different, aren't they? So
well, Dean came back and said exactly how you guys described it earlier. So there you go. That's the gold standard. If you obviously everyone's different, but give it a go and let's
shows it works.
Yeah, and it'd be really
absolutely.
interesting actually to know which base plate you're using actually. Dean and Tony. Tony also gets about a week unless he's talking a lot, which is really, really, good levels of adhesion. But I'd be really interested to know which base plates you're using that gives that for you. I mean, again, everybody is different, so it's what works for one might not work for another, but it's just interesting to know what people's regimes are and what they're using. So that's good.
I think also another little tip, once the base plate's been applied, is don't speak for at least 45 minutes or so afterwards, to allow that adhesive to stick properly. Because if you start speaking, your neck moves, the base plate will move, and it will start to work a little bit loose, and you've got more risk then of it blowing quicker. So that's another little tip as well. Try not to speak straight away. Dean says he uses the glue as well, so that'll be the silicone glue. And stability by the sounds of it in the orange pack. Some people do have to change their base plates every day, and some clinicians will recommend that as well. Again, it's down to personal preference. Some people, like Dean and Tony, I'm sure they don't want to be changing their base plate every day, so they try and get them to last as long as possible.
So I think I can see a couple of people who, and people will have different regimes for different reasons. So there may be, for Margaret, there might be a clinical reason why you need to change that every day, in which case that's absolutely fine. Again, Noel was saying that he was told to change it every day or every 2 days. And again, it's whatever. I mean, your clinicians are going to know you the best, so they're going to know what your skin's like, what treatment you've had, whether you've had radiotherapy, what the outcomes of that have been. So they're probably better placed in terms of telling you specifically for you what's going to work. Obviously, if a base plate is sticking and people are able to use it for a week, fantastic, very lucky, but very good. So I think it is. The biggest problem with HME usage is how we house it, and that's often the bit that your clinicians will have to work really hard with you to find the right regime for you. So I don't think there's a right or a wrong rule for this. I think it's very individual, but again, depending on what advice you've been given from your clinicians, it may be specific to your situation.
Another little question that's just snuck in there amongst the base plate chat was from Mark, and he says he's 2 years post-surgery. Would you recommend continued use of a nebulizer, daily, weekly, ?
again, that's down to each individual. Nebulizers, I would say go on what your mucus looks like. So if your mucus is particularly thick and sticky, then nebulizing is a good idea, whether that's a couple of times a day, once or twice a day. If it gets even more thick and sticky, you can actually increase this. This is saline nebulizers we're talking about now, not any of the other nebulizers that are, you know, are medicated for like COPD, asthma, that kind of thing. So for your saline nebulizers, you can increase them or decrease them according to the thickness and stickiness of your mucus. Some people choose not to nebulize, so if their mucus is perfectly manageable, they can cough it up and cough it out without any issues. They choose not to nebulize at all, but if they get a bit of a cold and the mucus gets a bit thicker and stickier, then they might start nebulizing for a short period whilst they've got that cold. So it's down to each individual really, but if you've got any further questions, it's definitely worth reaching out to your clinician about
I think
that.
for those people who maybe started off using nebulizers and then stopped because their mucus was manageable, unless there's a clinical indication for you to go back to it, or you feel that you need that, and you know you've talked it through with your clinicians or your ENT consultants, you know, you don't necessarily have to nebulize if you're able to manage it perfectly well without. But again, as Catherine said, it is very much a discussion to have with your clinicians, and there may be underlying lung difficulties that require that you have nebulizers. So a nebulizer really, with the saline, is designed not to sort of reduce the amount of mucus you're producing, but to thin it. So it's easier for you to clear it. So that's really what the nebulizer is for. So again, it goes back to what Catherine was saying about if you feel that you're congested or if it's a bit thicker and you would normally use a nebulizer in that situation, then that's absolutely great.
Great. Do we have any other questions? Maybe time for one or two more. There were some others that were submitted when people registered. I think there was one. Is there any new improvements in HMEs? I'm a very active person and would like to find an HME to last all day for me. Suggestions?
Well, I don't know what HME you use at the moment, but the Provox Life HMEs were launched, was that about 2 years ago now, Faye?
2 years.
Yeah, about 2 years ago. And within that range, you've got various breathing resistances, but there's also the energy HME, which was designed specifically for people exercising. So it might be worth discussing that with your SLT or your head and neck nurse, unless you're on that range at the moment. And then it might be worth having a chat with one of the ATOS Care customer care agents about that.
I think as clinicians, we would love to see a HME that does everything that a nose does, and that somebody could just pop on and wear all day and it would change the level of breathability and resistance and humidification. Unfortunately, that's still in the design days. So we haven't got one HME that will do all of that. And I think that's where Provox Life comes in really handy, because you have different HMEs for different situations that you will be in. So relaxing, sort of pottering around the house, the energy for more vigorous exercise, the nighttime for the highest level of humidification, and the Protect as well, which has obviously the filtration efficiency that, you know, it protects against viruses and bacteria. So I suppose that's as close to a one-stop shop that we've got at the moment. But yes, I mean, I think clinically we're always looking for that one HME that does it all. So yeah, if you have any ideas, then please do share them with us. We are more than happy to take that back to our research and development teams, but we haven't got it yet.
1 minute to go, unless there's any other questions in the chat. I think we've had one again. It's quite a deep one. Do we feel there is enough information given to patients about the life-changing realities to come emotionally, financially, and mentally, and what to expect post-surgery? Big question there, guys.
I think it depends on which hospital you're under and the information that you are given before the surgery. There's also a lot of information, as I'm sure you're all, aware. There's a lot of information that's given to you at a very stressful time. So there are things like there's the ATOS have a website which actually follows the journey of somebody going through a laryngectomy and discusses some of those issues.
Yeah, we have actually, for this very reason, recently collaborated to kind of pull a website together to kind of stop people from just Googling and, trying to pull from a million different sources and put it into one place. And we have kind of collaborated with clinicians and people and patients worldwide to, I'll pop it in the chat here, which is a really, really useful resource for those pre-surgery and for family and carers and etc. I think.
Yeah, Macmillan are very good as well, particularly for like the financial side of things. And they have their own benefits team, so they can, advise as to what people can potentially claim for and other things. And if you've got a speech therapist or a head and neck nurse who is Macmillan, as a lot of them are, then they should be able to advise you or be able to refer you to somewhere like the Macmillan Benefits team. You got any more thoughts on that, Faye?
Yeah, I think there's such varied practice up and down the UK, and we see this, within our roles within ATOS, that it's very, very different, and it will depend on your centre that you get your treatment as to what that multidisciplinary team looks like. In some areas, where we've got big surgical hospitals that have got all the MDT, that's great. But for those people who have their surgery and then perhaps go to a care hospital for their recovery, they may not have the same level of services. So I think, for us to be able to signpost you guys to something that's credible and that's got the right sort of most up-to-date information is definitely a way of us being able to support you. But again, it's highlighting if there are gaps, and if some of you feel that you didn't get that level of support, it's sort of highlighting to your clinicians where the gaps are, because services are always looking to try and improve, and that sort of psychological support is really important. In fact, probably more important than some of the technical stuff that you were ever told. So I think, you're absolutely right. There probably is quite a variation amongst just the people on this webinar today as to how that side of their treatment was managed. So yeah, hopefully there's enough credible resources out there now that you can access. But again, practice does vary so much up and down the UK. We do need a bit more of a consensus.
And individuals vary as well, don't they? Because some people want to know every single thing, and other people don't want to know anything. They just want to get through the surgery, get to the other side, and then deal with it as they face it. And that's fine, because we're all individuals and we all handle things differently, don't we? Have different coping strategies. So but yeah, if that information's available for those people who do want all of it.
Yeah, absolutely.
Okay, I don't think. Oh, Hannah's just shared the link to that laryngectomy site that I mentioned earlier as well, that follows a patient's journey.
Absolutely.
I don't think we've had any more questions. Noel was just saying that he's, with nebulizing, it depends on the situation. He's kind of come back to it as and when required, which might help with Mark asking that question earlier. But if there's no further questions, I think that's our hour. But if you do have any further questions, please do contact us, email, call. You can contact events, you can contact the nursing email, your customer care representative, and we can ask, Faye, Catherine, anyone, and get an answer back to you.
Absolutely, and thank you for all your really, really good questions. It makes it so much nicer for us to have that engagement with you guys, so thank you so much, and hopefully you've got something out of it. Keep your eyes peeled for the taste and smell webinar later in the year.
Yes, we do have a workshop as well coming up this month on the 21st. of February. So that will be like an open format, cameras, mics on. You can kind of chat and share experiences, and that's kind of in the style of I guess a nurse home visit, and kind of talking around like what your setup is at home and ways to help you kind of improve that or change it, or things like that, basically. So yeah, that should be another good one.
Lots of fun.
Yeah. Fab. Okay.
Okay.
Thanks
Thank
very
you
much.
for joining.
Nice to see so many people here today as
Yeah,
well.
absolutely. Have a great afternoon and evening.